Hi, good evening, everyone. I know there's 6 people here. I'm going to wait a few more minutes because it's just 7:54, and yeah, we'll just wait a few more minutes before we get started. But I just want to do an audio check just to make sure that everyone can hear me. Can you guys hear me? If you don't mind typing in the chat box to let me know if you can hear me. Okay, thank you, Lisa. Thank you, Rachel. Thank you, Monica. Thank you, Patrick. Thank you. Thank you. Okay, so just give me a few minutes and then we'll get started. You want to come say hi to everyone? Somebody wants to say hello. Say hi. Oh, her name is Tiffany. I call her Tippy. Yeah, she's a poodle terrier mix. I'm not sure what type of terrier, but she's a poodle terrier mix. I know it's 7:58, and before I get started with tutoring, I just want to at least go over a few announcements. Okay, so number one, welcome to online tutoring. So as you guys know, I went over this in class this week. This will be my platform for doing online tutoring. I will do this via YouTube live, and that way I can at least address any questions that you guys may have. The only thing about this platform is that I'm not able to show the PowerPoint slides and things like that, but you guys do have the PowerPoint and the video, so we don't need to kind of revisit that again with the tutoring session. But just to make you aware, the tutoring sessions will be focused on going over just like important concepts that I would advise you to focus on for the test. I'll give you some study tips. I can also address your questions. So as you can see with this feature, you're able to just kind of type in, do it with a live chat. So any questions that you may have, you can definitely put your question in the live chat and I can address it. Trying to think what else. Yeah, that's about it. I would say starting next week, just to make you aware, I'm going to have on-ground tutoring, which will be on Wednesdays. And that will be a little more kind of set up more like the video recordings that you guys have in Instructor Blog, where I'm actually going to have the video camera in the classroom and I'll be going over some topics that way. Whereas the live chat that I'm doing on Thursdays will be more for just like a Q&A. Just keep in mind with this feature with the live chat. So I know we have a number of people that are here tonight, but for those people that are not able to see this, it will also be recorded. So they're still able to see this live chat tutoring session even afterwards. Okay. So I just wanted to go over just some basic things. And yeah, I think that's about it as far as guys were able to hopefully go into chapters 1, 2, 4, and 7. And okay. It said my connection wasn't stable, but I think we're good now. Okay. So I believe you guys were able to take a look at chapters 1, 2, 4, and 7. That information you guys were provided in Instructor Blog, the videos and PowerPoints, as well as in class, I did give you guys a particular outline to kind of help you navigate certain items with that chapter. So just to start off, chapter 1 focuses on the framework of pathophysiology. So the topics that fall under the framework of pathophysiology do include okay, I apologize. My computer for some reason is saying the connection isn't great. Is this freezing on you guys or is it okay? I'm just not sure what's happening. Can someone just type and tell me if it's freezing? A little bit. Okay. Okay. A little bit. Okay. Okay. I don't know. All right. I'm just going to continue. So anytime it freezes, I'll just stop what I'm saying and then I'll just kind of pick back up if there's an issue. Okay. So again, for chapter 1, we start off with the etiology, risk factors, signs and symptoms. Also pathogenesis, explaining what that means. I would go over those topics and definitely focus on the term, the definition, and also examples. I believe I gave you guys some really good examples when I was, I should say, in the video that I provided. That information I think is pretty straightforward, so you should be okay there. The next topics I believe that I went into were, and I'm trying to think, I don't have the PowerPoint with me, so I'm just like kind of going what's in the textbook, or I should say, let me just go by what's in my head. Oh, it's frozen. I'm frozen completely. Okay. It doesn't look like it's frozen now. It's frozen just like the movie. Okay. Oh, I'm sorry. I'm losing everybody. What is going on? Okay, I don't know what happened. Okay, so everybody's having to refresh, it looks like. Okay. Okay, thank you, Art. Okay. Yeah, I don't know what happened. That was weird. Yeah, I didn't have this problem before. Um, I know Mercury's going in retrograde February 14th or 15th or something, so we should be fine now. Okay. So anyway, just to get started again with chapter 1. The first items we did focus on were the framework of pathophysiology. So knowing topics like etiology, risk factors, pathogenesis, signs and symptoms. I would suggest to please go into those terms. Make sure you know the definitions as well as the particular examples that I provided. Not that I give those exact examples on the test questions, but the examples does give you an opportunity to figure out, okay, well, this is a type of example she could use, or, you know, how to navigate the example, basically. Just to elaborate a little more, when it comes to risk factors, remember that a risk factor is the likelihood of a disease process happening, whereas an etiology is the known cause for a particular disease. Okay. So if we know a particular bacterium, or if we know the virus, or, you know, whatever's going on, we know that that's actually the etiology. So like, for example, right now, we know there's an outbreak with the coronavirus. So when these patients have signs and symptoms that are occurring, and based off of whatever findings that happen with that particular condition, they are able to test and figure out, okay, well, these patients do have what is called the coronavirus. So the coronavirus would be what we consider a known etiology. So that's the cause for that particular disease. Okay, so Lisa has a question. Can you explain the SOAP note a little more? Yes. So in the video, I did give you an example of what we consider a SOAP note. And so before I get into that, let me just first go over what we consider a sign and a symptom. And then I'll carry that over into the SOAP note. So a sign is basically what the patient feels. So, or I should say, I'm sorry, let me take that back. Wrong way, wrong way. A sign is basically what the clinician is able to observe or measure. So let's say you are able to measure a patient having, let's say, pitting edema, or you can measure a patient's blood pressure, or you can see that this patient has some sort of rash or whatever's going on. So anything that a clinician can see or measure, okay, is basically what we call a symptom is going to be what the patient states, or another term we use for that is subjective, whereas a sign is more objective, okay? So a symptom is going to be subjective. So what the subject is feeling, the patient is feeling. So a patient can say, oh, I feel itchiness to my skin, or I feel like a burning sensation, or I feel like my leg is heavy. So the patient can state that their leg feels heavy. But in regards to the leg feeling heavy, they have edema that's occurring. So the feeling of the leg being heavy is going to be more focused on the symptom that they're having, whereas the sign is going to be the fact that you can see that they have edema, okay, if that makes sense, okay. Now, the example I gave you in the video about a SOAP note, the SOAP note is basically a type of progress notes that some clinicians use to do charting, basically, so patient charting. You guys as nurses do use what is called the SBAR format, so you don't use exactly the SOAP note of note taking. Now, the SOAP note is not too far. Uh-oh, it's saying it's unstable. Okay, it did something again. Can you guys still hear me? Oh, I think I know what's going on. Okay, I think what's happening is when there's more people that join, depending on the amount, it just kind of freezes for a moment. So, yeah, because I noticed the number jumped up to like 25, and when it freezes, it continues where you left off. It does not skip any dialogue. Okay, okay, thank you. Okay. Thank God for YouTube. Okay. So the thing here is when we talk about a SOAP note, this is a type of note taking that clinicians use with patient charting. You guys as nurses will use the SBAR format, but I want to show you I showed you what the SOAP note looks like, but it's not too different than the SBAR. So S stands for subjective. So this is going on. Okay. The O stands for objective. So this is going to be where you're going to put your signs. So what you see as a clinician. So you see that they have, you know, edema or whatever type of, you know, finding that you can measure. So that can be vitals or whatever the case may be. Okay. A is going to stand for assessment. So usually with your assessment, you'll put whatever assessment findings. And sometimes people in this section will also put their particular diagnosis. So for you guys, what is called a nursing diagnosis. And most of the times your nursing diagnosis is basically the different than a medical diagnosis. Okay. And then the P stands for plan. And plan is going to be basically whatever your treatment or your management is going to be for that particular patient. Okay. Now, how that correlates to the SBAR, not too different. So with the SBAR, S stands for, oh gosh, I can't think now. Situation. So S stands for situation, B stands for background, A assessment, and then R recommendations. Okay. So with your SBAR, the S for situation, you're going to state basically what's happening, what's going on with the patient, what's the situation at hand. B, background, what is the patient's background? So this can include any kind of past medical history, whatever kind of findings that, or I should say things that may correlate to what's happening. A, assessment, what is your actual assessment with this patient? And again, you can also include possibly, you know, your problem list or your working diagnosis. And then R for recommendation. What are your nursing recommendations for that particular case? Okay. So I know I spent some time on that. I forgot who had the question I was trying to look. But anyway, hopefully that answers your question. I do not have direct questions with that for the first quiz. So I just want to make you aware as far as like SBAR and SOAP note. But you should know what's the difference between a sign and a symptom. Okay. That's important. And just kind of focusing mainly on that. Okay. And so not anything else. As far as like patient charting and note taking, I don't have direct questions with that because it's not a nursing course, but I just want to show you how when we discuss the sign or the symptom, how that information just kind of spills over into your patient charting. Okay, so that was just basically where I wanted to go with it. Patrick, somewhat different variations of ADPIE. I'm not sure exactly what that acronym stands for, ADPIE. Patrick, I'm not sure what that is. If that's a nursing code or topic, I'm not sure. But I just gave the SOAP and the S-bar in the video just as an example, just to show you how it works, but not, you know, I'm not testing you on that. Okay. Okay, so moving on. We did have topics like, yes, and I'm going to get into that latent and prodromal in a second. We did have topics such as what we call iatrogenic and sequela. So sometimes people get these two terms a little confused, and I just want to clarify the difference between the two. So when we talk about a medical condition that most likely came from some sort of medical treatment as a side effect or possibly post-surgery. So just to give you an example, let's say, for example, you have someone that, and I think I gave this example in the video, they go in for surgery, let's say for a hernia repair, they come home, they take Norco. Norco, unfortunately, can make the stool hard because the way the medication processes in the body, it kind of reabsorbs a lot of water. Now that patient will need a stool softener. So the patient will end up with constipation or have issues with bowel movement because of the particular medication of Norco. It wasn't intended for that to happen, but it happened because of, you know, as a side effect of that medication. Another example I can give you is, let's say, well, let me just jump to sequela. When we have sequela, sequela is a condition that happens, and then you have a secondary condition that kind of follows, and it's just almost like a cascade of events. A good example I can definitely use is what you guys are covering in chapter 7, which is actually the cancer. So when patients have cancer, cancer is the primary diagnosis. When we talk about cancer, cancer will now lead to secondary conditions, and there's a sequela of events that can occur from that. So when a patient has cancer, it's not just, okay, cancer only, and there's nothing else going on. Definitely, as cancer advances, they can definitely lead to issues such as leading to infections, leading to possible anemias, maybe bleeding issues. Other secondary conditions will pop up, which is what we consider a sequela. Okay, so there's additional pathological conditions that come from one particular disease. Okay, so hopefully that makes sense, the difference between iatrogenic and sequela. So let me go back to some of these questions here. So Deanna, I'm going to get to your question in a second. Okay, Patrick, the FWIW assessment, diagnosis, nursing plan intervention. Yes, okay. So again, that's a good example, but I'm just telling you right now, I'm not testing you on that. That's definitely for your nursing courses. I'm just giving you the foundational things for patho, making sure we know how to use the term sign, symptom, you know, risk factors, things like that. But as far as the actual assessment, and I don't want anyone to get too, you know, bent out of shape over those terms, because I don't have test questions with those. Okay. So Diana, so getting to your question, latent and prodromal. This is a very good question, because those are definitely topics that people get confused with. So latent, and let me just kind of give an example that I gave in class, or I should say in the video. So let's say right now, we all know the things that is very important to know with this particular virus is practicing hand washing and making sure people know how to properly cough like this, okay, and sneeze like this, okay. And so anyway, let's say, for example, someone has a coronavirus, you're on the plane with them, and they don't do this when there's time for them to sneeze. Okay. So what's going to happen is that now, once you are exposed to that person, just kind of, spreading their germs, the latent period is basically when you are exposed to that particular disease or condition, but your body is now processing the development of it, but you may not necessarily have signs or symptoms at that stage. If you do, they may be mild or silent. So let's say, for example, again, excuse me, you're exposed to the coronavirus, and that person that sneezed in your face, now you may feel like a little tickle or something in your throat or whatever's going on maybe the next day, but not really quite a full-blown sign or symptom. Okay. Or you may not feel anything. So that's latent. I'm so sorry. Sorry, I know that scared everyone right now. Prodromal is going to be a situation where, I'm sorry, let me close this door. Sorry. Okay. So prodromal is going to be a situation where now the patient will develop signs or symptoms, and the signs and symptoms are like abrupt, or I shouldn't say abrupt, but basically it's full blown. So you would say like they're going to be sneezing, coughing, fever, stuffy nose. I know I sound like the commercial. Headache. So, they're going to have the whole shebang. So that's what happens with prodromal. And so to kind of help you, if you do have a test question with this, and I think there is a check your understanding question with this, when a person has prodromal, or I should say, when a person has full-blown signs and symptoms and we know it's there and it's set, you want to pick the term prodromal, because latent is telling us that it's a possibility that they may have signs or symptoms, but it's not a definite. Okay, so hopefully that makes sense. Diana? Okay, and so Art, I will get to your question. So Art has a question. Would you kindly explain syndrome versus signs and symptoms? Yes. Okay. So a sign and a symptom, first of all, are two different topics. Okay, great, Diana. Okay, so a sign is basically what you observe as a clinician, as the nurse, what you see, what's happening with the patient. Okay. These are findings that you can actually measure. Another term that can be thrown in here is something called objective. So objective findings. A symptom is basically what the patient feels. So if the patient has, or another term that can be thrown in here is subjective. So they're kind of two separate terms in itself. A syndrome is basically when a patient has an entire set of signs and symptoms that sort of overlap each other, but it doesn't quite directly correlate to one particular disease or condition. And honestly, the only example I can give you for this is AIDS, because AIDS is designed, or I should say, titled acquired immunodeficiency syndrome, which means that these patients do have a set of signs or symptoms that kind of all correlate, mesh together. But it's not saying that, okay, well, that patient has a fever because they have an infection, or that patient has, a rash or itchy skin because they have Kaposi sarcoma. Okay. We know when patients have AIDS, full-blown AIDS, that the virus has now got to the point where there's a lot of opportunistic conditions and things all kind of meshed in together at once. So a syndrome just kind of explains that there's a set of signs and symptoms just kind of pulled together, but we cannot differentiate basically which disease that it correlates to, because it's just a combination. Okay. I hope that answers your question, Art, if that makes any sense to you. Okay. Sorry, one second. Okay. Does that answer your question, Art? Okay. So the next thing I just want to get into is focusing on, I think we went into terms like, what was it? Epidemic, pandemic. Okay, great. Epidemic, pandemic, endemic. So the only thing there, just making sure you know the terms, definitions, and you should be fine. And I think the last little bit of information we went into chapter 1 was focusing on the levels of prevention. So we have primary, secondary, and tertiary. So this gets a little tricky because I know your textbook, and let me just confirm. I have the textbook here. Unfortunately, I have the 5th edition in front of me and not the 6th edition, but it's still the same information. Okay. So let me just clarify something about the levels of prevention. So number 1, the first level of prevention focuses on, how we can prevent the disease from starting in the first place. Okay. So we want to look here about, education, nutrition, definitely vaccinations. I think we all know from microbiology the herd effect. And so understanding that vaccines do help in that particular situation, making sure that people don't contract, diseases that way. So we understand primary. Secondary is going to be more focused on, and this is where it gets a little tricky, and I'm going to go by what's in your textbook. Okay. So secondary is going to be more focused on like screenings, examinations, physical mammograms and prostate checks and all that kind of stuff. So that's going to be more secondary. Tertiary is going to be focused on purely treatment. And so that can be, physical therapy, surgery, medications, definitely alternative therapies as well. So or it should say not, how can I say accessory, but other health professionals that are needed to come in. So like social work, PT, OT, whatever. Okay. So whatever type of treatment or management that needs to take place with that particular case will fall under tertiary. So I just want to clarify that because I don't know exactly what was what in the video. Anyone have any questions with chapter 1 before I move on to chapter 2? Okay, so no questions with chapter 1. Okay, so I'm going to move on to chapter 2. Chapter 2, this information, as you notice from the PowerPoint, it was not a lot of info. I just gave you a few concepts, and so I'm just going to go down the list of concepts that you should focus on. So number 1, make sure you know the term allostasis and homeostasis. It is important to know the definitions. And so just in case if anyone gets confused, I think we all know that homeostasis is where the body is working at an ideal set point. Okay. So everything's functioning, blood is pumping, endocrine system's working, glucose is doing what it's supposed to do. And, everything's working at an ideal set point. Allostasis is when the body recognizes that we're not working in that ideal set point. And so now we're going to put in or kick in systems to make sure that it goes back to normal. And so we know that our bodies have, let's say, for example, buffer systems, or when the body recognizes that we have too much glucose in the blood, that it knows how to take it and store it, okay, in the liver cells and things like that. So, just making sure allostasis is making sure the body systems know what they need to do. So they're, have their job in place. When we discuss the next categories of stressors, so making sure you know the different types of stressors. So We have emotional, chemical, physical. So just making sure you know what they are. We should also know the systems that are involved with stress response. And I believe the PowerPoint breaks it down into like the nervous system. And here we explain that, epinephrine, norepinephrine is secreted, your endorphins and kephalons, and what they do. We know with the endocrine system that we have our adrenals. And so we have also uh, cortisol, aldosterone, and all of that, everything secreted there. So I would know the hormones and catecholamines, or endorphins and whatever is secreted with those systems. I would know that. Okay, that's important. And I would say that's about it. It really didn't get into a lot of detail, and I made it that way. I didn't want to give you so much information with chapter 2, but my main focus is making sure you know what systems are working, what is being secreted to kind of help with that particular situation. And then that's it. Okay. Yeah, I can't remember what else I put in that PowerPoint. Oh, also part of that includes the general adaptation syndrome, which I think is also part of your discussion board question. So the general adaptation syndrome, where it goes into like the stage of resistance and alarm phase and all that. So that all correlates, yes, with how the body responds to stress. And so I would go into those topics as well. Okay. Okay, so does anyone have any questions with chapter 2 before I move on to chapter 4? No questions? You guys still there? I see 22 people. I see. And my dog is still barking at something. Okay, so let me move on to chapter 4. So for chapter 4, okay, Patrick, adaptation and coping slide. Oh, yes. Okay, yes. So adaptation and coping, it kind of correlates a little bit with, I don't want to say the general adaptation. It kind of overlaps a little bit, but yes. So the answer to your question is yes. So adaptation is basically when the body knows how to adapt to a particular situation, and it will make changes to that for the better or moving forward. Coping is how the body will respond to it, but it may not make the necessary changes to completely take care of everything moving forward, if that makes any sense. So if you think about it like, um, I'll use emotional stress as an example. So let's say a person is, grieving over, a death or whatever is happening. So usually the coping mechanism, sometimes people can cope by, alcohol, or, even sometimes people have healthy coping mechanisms where they, go and run and, be more active, whatever the case may be. But the body's coping, in that environment. When we talk about adaptation, it's where the body will now start to change completely. So let's say the nervous system will now kind of rewire things to where now that person is, not as anxious or not as, depressed or things like that. So the body completely adapts. And so, but adaptation and coping do overlap with each other a little bit. But I would say, yes, go over those topics just in case if they are on the test. But I honestly try to stay away from adaptation and coping because those terms do overlap with each other. And even your book kind of says that. Okay, so art is coping after the fact, almost like recovery. Yes, you can definitely look at it that way. So coping is definitely after the disease or condition or whatever the emotional, or I should say whatever the stressor is. Yes, so definitely coping is after. Yes, like a recovery for sure. Okay, so are we good with chapter 2? Okay, so moving on to chapter 4. Chapter 4 focused on cellular injuries. And so with this particular chapter, I explained to you guys in class that um, disease process first starts with the injury to the cell. And so there's going to be some sort of, damage to the cell that's now going to happen to the tissue and the organ and that whole thing. So in chapter 4, we're focusing on all the different types of cell injuries that can occur. And so when we discuss cell injuries, this is explaining and it breaks it down into 2 categories, reversible and irreversible. So with reversible cell injury, these are cell injuries that can be reversed, usually if you remove the stimulus or whatever the case may be. And then things that are irreversible are things that cannot be reversed on its own, basically. In most cases, the only way to reverse it is usually through some sort of intervention like surgery or, some kind of medical treatment. Okay. So just to quickly go down the list to help you organize these topics. Let's start with reversible cell injury. So under reversible cell injury, the very first topic, or excuse me, reversible. Under reversible cell injury, the very first topic that was focused on was hydropic swelling. So I wouldn't know everything about hydropic swelling. I know it went into what happens on the cell membrane and the sodium potassium pumps and that whole common type of cell injury. Okay. When it comes to that part, it also piggybacks, or I should say adds to the term megaly. And yes, I think that kind of is worked in there somewhere, megaly. Okay. The next category under reversible is something called intracellular accumulations. So with intracellular accumulations, there was like a list of different things that I think was in your PowerPoint as well as the video. And so it went into things like lack of enzymes, when there is toxins coming into the cell that can't be broken down, genetic alterations, or when the cell doesn't function in one area, and then now we have an accumulation, intracellular accumulations. So just make sure you know kind of all those categories and that they do fall under the case of consider those type reversible. Okay. Now to continue on the reversible category. Okay, it did something, but now I'm back. Okay. So to continue on the reversible category, we do now have a second or subtopic or subcategory of cellular adaptations. So for cellular adaptations, we have atrophy, hypertrophy, hyperplasia, metaplasia. Okay. And those first 4, I would say put under reversible. When we get to dysplasia, dysplasia is going to start our irreversible category. And I believe I explained this in the video. So I just want to make sure disordered appearance that you'll see with cells. Okay. In particular, this is also another term of what we call precancerous. So these cells will possibly turn over into cancer. Okay. We do consider this irreversible because if you let this sit there, even if you remove the stimulus or whatever could be the possible risk factor, it doesn't mean that those cells are going to go back to normal. The only way to revert those cells back to normal is through treatment, and that's a possibility as well. Okay, so this is why we put this under the irreversible category. Although for those of you who are reading your textbook puts it under the reversible section, and not to cause confusion, but for test purposes, I do have it more under irreversible, because it basically is irreversible. Okay, unless we're hoping that the treatment goes well. Okay, and that's, again, we don't know for sure. Okay, so I gave you a good example of cervical dysplasia for that one. Okay, the very last two topics, and I do want to clarify, and I'm going to go into more detail with this here in the tutoring, because I don't remember if I had the information in the PowerPoint and it wasn't in the video, or if it was in both or what, but I felt like it was missing somewhere. But basically, we have two topics: necrosis and gangrene. Now, before we get into the more detail, just overall, when we hear of necrosis and gangrene, I want you to know that this is where there's a lack of blood supply getting to tissues and organs that are actually going to cause those tissues and organs to die if it doesn't have blood supply. So most of the times it will just become dead. It, breaks off, wears away, whatever the case may be. When we use the term necrosis and gangrene, necrosis is a term that we explain to, or I should say, use to explain the cellular tissue damage, whereas gangrene sometimes is used to explain the body part. Now, sometimes in textbooks, you'll see that they explain gangrene as caused by a toxicity or what have you. But even if the dead tissue happens because of toxicity, please understand that there's also a lack of blood supply that goes along with that. So in general, when tissue becomes dead, it's due to a lack of blood supply, hands down. So whether there was a toxin or not, it's a lack of blood supply. Okay, so the next thing we got into was explaining the different types of necrosis. And so the only thing I want you to know is just the term, what's happening, and a possible, example. So the first type of necrosis we have is coagulative necrosis. Coagulative necrosis is basically explaining that this is a type due to a lack of blood supply, the tissue becomes dead. A very good example here are extremities, fingers and toes. And so, for example, when we hear frostbite, people having frostbite, so that kind of correlates with that one. The next type of necrosis we have is liquefactive. Liquefactive necrosis is basically a liquefaction that happens to the tissue, and the tissue, instead of being nice and solid, it actually will start to break down and liquefy. Just to make you aware, most liquefactive necrosis do happen in internal organs because of the environment, but you could possibly have liquefactive necrosis also externally. And it just depends on, the case and what's causing it. The next type we have is fat necrosis. Fat necrosis is basically what it says in its title, fat necrosis. So these are fat cells that are actually bursting and causing the tissue. And basically the tissue kind of makes like a soapy appearance to it, where it just looks like fat. Like if you clean a chicken and you see the fat, just kind of on the chicken, it kind of gives that appearance because the fat cells are just kind of bursting. And so it just kind of makes these little yellowish, kind of bubbly looking things to it. Excuse me. The last one is, what is it? I can't think of what it was now. Caseous, definitely secondary to TB, or could be secondary to TB, depending on how advanced it gets. And caseous necrosis is when the lung tissue actually becomes dead, and it makes more of like this crumbly blue cheese appearance to it. And that's that. Most of the times when you hear the term caseous necrosis, it's always going to be associated with TB. So if you see it, just think of TB. However, there has been some cases where caseous necrosis could happen secondary to syphilis in the testes with men, but not that common. So we're just going to go with TB. Okay. Now, gangrene, just to, in case we use these terms, gangrene, dry gangrene is associated with a coagulant necrosis, whereas wet gangrene is associated with liquefactive necrosis. And then I think I went over in the video or the PowerPoint gas gangrene, which is basically a bacteria that destroys the muscle tissue and it gives that type. But for test purposes, I just want to make you aware I would not give you a question that says, okay, tell me what type of necrosis and gangrene in the same sentence. Or I should say, a better way to explain it is this. I would not give you answers that include necrosis and gangrene. It's either going to be one or the other because the terms do overlap with each other. Okay, so if that makes sense. So whatever questions you have, it's either going to be talking about all necrosis or either all gangrene, but not both in the same question or category because I don't want to confuse you. Okay. So any questions with chapter 4? The only other thing from chapter 4 that I think was in your PowerPoint maybe is the term apoptosis. And apoptosis, I'm quite sure you went over this in physiology, programmed cell death. Okay, that's all you need to know. I think everyone knows what that is. And it is a part of the process of cell injury as well. Okay. Okay. So if there's no more questions with chapter 4, I'm moving on to chapter 7. And what to say here, you need to know everything. Okay, there is nothing that I could say for chapter 7, focus on this and not that. Because number one, cancer, unfortunately, is one of the top diagnosed conditions, diseases that we have in the US and globally. So do you need to know everything about cancer? Yes, you do. And so all the information that I gave you in chapter 7 kind of focuses on the basic foundation of cancer, understanding the difference between benign and malignant tumors. I would definitely know the characteristics between benign and malignant tumors. You should focus on the definition of metastasis, what happens with that. You should focus on what through blood work and biopsy, the purpose of them, which is to help us diagnose. It is definitely a diagnostic tool. We should also know, I think it went into other ways of diagnosing like blood work or something like that. I can't remember. But we should also pay attention to bone marrow suppression. Okay. Monica saying no. I don't know. Okay. I'm not sure what you're saying no to. But we should focus on definitely bone marrow suppression. And with bone marrow suppression, we should focus on understanding that if a patient has bone marrow suppression, that means that all blood cells are decreased, white, red, and platelets, which means that these patients can be more at risk for infections, for bleeding issues, and anemias as well. And so that is so important to hold on to. We also explain the information on how cancer treatments attack rapidly dividing cells like epithelial and blood, which is why cancer patients have the hair loss and the skin lesions, GI issues, and things like that. Okay, so let me get to Art's question. Benign versus malignant. Benign continues to grow but never attacks the host versus malignant grows but attacks the host. And this correct? Yes, yes, that is the way to look at it. Yes. So what happens are with benign tumors, sometimes they grow, sometimes they don't. It just depends on the tumors don't have a lot of blood vessels surrounding them. Okay. However, malignant tumors have a lot of blood vessels surrounding them, which means that they can grow a little bigger. And not only that, because there's a lot of blood supply, a lot of blood channels, now those cancer cells have why it attacks the host. Okay, if that makes sense. So it's more so really the blood vessels surrounding it. Okay, so hopefully that answers your question, Art. Okay. So getting back to everything else in 7. The names of cancers. So I think we all took a look at oma, sarcoma, carcinoma, and understanding how they're used. Okay, great. Understanding how they're used. And not only that, we did see that there were some exceptions to the rule, such as leukemia, lymphoma, I can't remember all the omas now, hemangioma, and something else. Okay. Madison, no. So Madison, I did explain in class as well as just a minute ago. I don't need you to memorize all of the tumor markers that are listed in your book as far as like the types of tumor markers, but you should know the tumor marker, like what is the information behind it. So you should know that a tumor marker is a diagnostic tool. So basically, blood work or biopsy, they will determine what the tumor marker is for that particular cancer. So that way they can diagnose that that is the primary cancer. That is just about the only information I need you to know about that. In the video, I know I did explain table 7.7 and 7.6. I am not holding you responsible for that information. We will use it in our class activity next week, however, but I'm not responsible for knowing or memorizing all the tumor markers for all the cancers for the test. I am not holding you responsible for that. So the only tables that you guys are responsible for are table 7.1 and 7.2. Okay, so just 7.1 and 7.2. Okay, great. The rest of the PowerPoint went into warning signs. So just kind of like, what are the major symptoms that happen with the different cancers? And I think those are pretty self-explanatory. And then what else? Cancer treatments. And I don't know if I'm missing anything else. I'm trying to think here. I don't have the PowerPoint, so I'm just kind of like scanning through. Don't know if I went over like yeah, I think that was it. I think that was it. Oh, grade aging. Oh my gosh. Sometimes people get this confused. Make sure you know grading and staging. So just to clarify, grading is looking at the histology slide, okay, and looking at how abnormal the cells are, whereas staging is looking at the patient. So the patient has a tumor here, and then now it's spreading. Staging is basically on the extent of the spread. The more the cancer spreading through the body, okay, it did something, but I think we're good now. The more the cancer spreads through the body, the higher the stages, okay? And so we should at least have an idea about that. There's a medical term that was brought up in chapter 7 that kind of piggybacks a little bit from 4. And there's a term called anaplasia. Anaplasia is a term that's used when we're talking about the grading procedure. So it's basically saying that these cells, we know we're getting this tissue from, let's say, the prostate gland, and we know what these cells are supposed to look like. But unfortunately, when we take a look at the tissue under the microscope, it looks like something totally different. So the higher degree of how can I say, disorientation of these cells or unorganization of these cells. This is what we call anaplasia, where it's like the term that's used when we definitely diagnose cancer, chapter 4. Okay. And I think that was it. I think that was it. Does anyone have any questions? I'm going to leave this rest of this time for Q&A. So whatever questions you may have, you can type it in and I can address it. Okay, so Nicole. Okay, so, oh, Laura, when is our first exam? It's next week, Laura. So starting next week, we have our first quiz. So chapters 1, 2, 4, and 7, everything you're studying for this week, you will be tested on next week in class, and then we'll be moving forward from there. So each week we have quizzes on our chapters. Okay, so Nicole, in class you said not to memorize 7.2. So 7.2, I just wanted you to take a look at it just so you can see how the suffix is used, ulma, carcinoma, things like that. So you don't need to memorize each and every item, but if you know that ulma is behind benign tumors and sarcoma and carcinoma are used for malignant tumors, and just kind of understanding that. Okay. So, but I just told you to take a look at the table 7.2 just to have an idea, but you don't need to memorize it. It's just more so to get more examples, basically, to understand. Okay. So if that makes sense. So Diana, opportunistic infections only attack immunocompromised. Yes, that is true, Diana. Yes. Yes. So when patients are immunocompromised, they, they're more prone to infections or infections where people normally don't get certain types of infections, and it's because they are so immune compromised. Okay, and they're at more risk. So yes, that to answer your question, Patrick. So should we chapter 7 down completely also? Okay, so yeah, so I just went over, and I'll say it again. 7.1, and I'll pull it up. I have my book right here. Let me pull it up. Okay. 7.1 covers like characteristics of benign and malignant tumors. And so this is just like extra information added to what's in the PowerPoint. Okay, so I would say take a look at this just to memorize, yes, some additional characteristics. I would say yes. 7-2 or 7.2, as you can see, this is a very long table. Okay, it actually has a lot of information here. It goes into benign, malignant, it breaks down the cell tissue type and the terminology. I don't need you to memorize all of this, but I want you to just take a glance at it just so you can understand what types of, or how we use the terms. Basically, in the video for chapter 7, I did go into detail with how to use ulma, carcinoma, sarcoma. So if you watch the video, you'll see me go into that. If you understand how we use the suffix, then you should be fine. Okay, You don't need to memorize this. However, what you should memorize is the exceptions to the rules, like lymphoma. I think it's like hemangioma and something else, hepatoma. So I would memorize the exceptions to the rules, which I think are in your PowerPoint. Okay. So hopefully that answers your question, Patrick. Art, for cancer treatments, do we need to know the actual procedures or in general? Just in general. Just in general. So I don't have a lot of questions with, a lot of detailed questions with cancer treatment. So surgery, we know what that does. It removes the tumor. Chemotherapy is used to kill the most rapidly dividing cells, and in particular, rapidly dividing cancer cells. But unfortunately, it takes other cells along with it that we know. And then radiation is used to shrink the tumor by killing the blood vessels surrounding it. Immunotherapy is used to boost that patient's immune system so they can now, attack the immune system can attack the cancer better. And I can't remember what else. Bone marrow suppression, not bone marrow suppression, excuse me. Bone marrow transplant or stem cell transplant is used to give that patient nice, healthy bone marrow tissue to, again, help fight the cancer. And that's just about basic information I need you to know, okay, about that. So hopefully that answers your question, Art. Okay, Patrick, should we expect up to 30 questions on week 2 quiz? Correct. Pardon, I just told those before answer. Oh, that's okay. For the first test, I don't have 30 questions. I think it's like 20. It's 20 questions. I usually do 30 questions when we have like 5 chapter weeks. I know that students like more questions, but we're kind of told to make it a little more strenuous. So we have limited questions, even though it's like 60 points. So long story short, I do have 20 questions for the first test. And it's a quiz, basically. Quiz test, same thing, but there's 20 questions. Okay, so any other questions? Okay. Okay. Yeah, it's 20 because it's just a quiz. It's you guys only have a half an hour. You only have 30 minutes to take it, so I don't want to give so yes, it's 20 questions for the first one. There are some weeks where we have 25 to 30, because we'll have more topics, but that's about it. Okay, so if there's no more questions, I'm going to call it a night. And you guys have a good weekend. It is Super Bowl weekend, so for you 49ers fans, have fun. I know a lot of people are 49ers fans, that's why I said that. But you guys are good. Oh, okay, so Patrick has another question. For some reason I missed it. It's probably in the portal, but your Wednesday tutoring times are when? Patrick, I did not post the Wednesday tutoring as of yet because I don't have my schedule. I'm still waiting on the office to give that to me, okay? As soon as I have it, I will post announcements. Just to make you guys aware, I post announcements all the time. So I would say somewhere around 3 or 4, but I don't have the room location and the exact time as of yet until the office provides that information for me. Okay. Okay, so hopefully that helped everyone. Again, you guys have an excellent and happy weekend, and I will see you next week in class. Okay, bye. Yes, Zaire, yes, this live feed is a set later. So because it is actually recording as we're live and we're streaming, so anyone that goes back to the link where I originally posted the link in the announcement, you can click on that and you can watch it again. Okay, so you can just go to the same link and it'll be there and you watch it. And that's for everyone. Even if someone is missing tonight, they can go back and watch the recording. Okay. All righty. So have a good night.